This episode is made possible by our sponsor, Omega Bright Wellness. I've taken their omega-3 supplements for many years, and so has my wife, and that's why I invited them to sponsor my podcast. I'm proud to have them. You can find all of their products online at omegabrightwellness.com, and Bright is intentionally misspelled B-R-I-T-E, omegabrightwellness.com. Hello, this is Dr. Ned Hallowell, and welcome to Distraction. Today, we have a very special guest. I love interviewing people whom I admire, who have achieved greatness in many different ways, and Dr. Lloyd Sederer is one of those people. He's reached an age where he's seen an awful lot, and I just think it's a great thing to interview people who've seen an awful lot. And you know, so I'm not going to stick to one topic. I'd love to just roam far and wide. He knows about mental health inside and out. He ran a unit at McLean Hospital, which is sort of the preeminent private psychiatric hospital in the Harvard.
I ran the hospital.
You ran the hospital. I'm sorry. He ran the entire hospital, which is the preeminent Harvard psychiatric teaching hospital, as well as one of the preeminent, if not the preeminent, private psychiatric hospital in the country, if not the world. So he ran that, and then he went from the private sector to the sector that couldn't be any more public than the New York Department of Mental Health, and oversaw that chaotic environment and brought some order out of it. And all along the while, he's maintained an avid interest in writing. And his most recent book is, in fact, a memoir entitled Ink Stained for Life, Coming of Age in the 1950s, A Bronx Tale. And I couldn't recommend it more highly. If you want a really engaging read along the lines of a nice Jewish boy growing up in the 1950s, destined for a writing career in spite of his best efforts to turn himself into something else. He's been writing, and he's also has an extraordinary ability as a critic. His reviews of movies are wonderful, and I recommend you check those out. But the main reason that I want to have him on is simply his font of knowledge, his far-ranging, always curious, always articulate, always wise, and also funny take on life in general and issues regarding human nature and mental states in particular. So with that introduction, Lloyd Sederer, welcome to my podcast.
Hey, Ned, I should stop while I'm ahead. Probably disappoint after an introduction like that, but I always love a conversation with Ned, and where we share a lot of background, Boston background, training background. So
yes. Should we start with mental health? I mean, what would you say is the 2 or 3 most pressing issues in mental health today, aside from insurance payment parity? What would you say are the issues that our listeners ought to be concerned about?
I think the preeminent one right now, and not going away for a while, are the mental health and addiction consequences of COVID. They're not just the neuropsychiatric problems that the disease is associated with, the lingering problems with thinking and with mood and motivation. It's also the social isolation, which actually we need to do from a public health point of view, but it cuts us off from close contact with other people, and we're social creatures. So we have a bad disease It's not just a respiratory disease. It affects many organs, including the brain. And then we're shut off from what all of us need, which is other people. And then for many people, the economic, financial consequences are very bad. So you put all that together. I think that's the number one problem that we face now, that so many people face in terms of the degree of distress, the relapses that people have into depression, alcoholism, drug abuse. So that's number one. Number two, and this is about our profession, Ned, is that we actually know a lot about what works, what helps people. But the gap between what we know and what we do is embarrassingly large. Mm-hmm. And that means treatment is very uneven. That sometimes you're lucky, or sometimes you've done enough background, so you find the right kind of treatment and it's rendered in a way that's effective. But most of the time, that doesn't happen. So that's a gap that has to be closed for large numbers of people to actually get what they need and improve. And the third thing is also a very big issue today, which is the inequities. If you're a person of color, you're much less if you're a person of color, you're much less likely to get good treatment, to have access to treatment, and in many cases to even have insurance to pay for it. So that's a trio right there. There's a lot more, but three's enough.
Well, yeah, absolutely it is. Let's take them one by one. I mean, the ravages of COVID, medical, mental health, emotional, social. What is the average person? What can the average person do? You know, I'm always talking about vitamin C, Vitamin Connect, and you know, as you point out, these days it's harder to do. Is that a good starting point? Maintain connections during this difficult period?
There are a few things I think that make an important difference. One of them is to over-communicate. In other words, because we're being starved for connection in this public health position we need to take. So don't, so if you speak to somebody on Zoom once a week, families, do it twice a week, or phone calls, or other way. Go for a walk 6 feet away from those that people you care about. So over-communicate because we're not getting enough of what we need. The other thing for so many people who are employed is that life has changed. They wake up in the morning and they don't have to shower. They don't have to dress. They don't have to get on the subway. And that what that does for many people is it discombobulates us. In other words, we have a potential loss of the kind of structure that work creates. And if you can, hold to a structure. Get up. Don't spend the day in your pajamas. Get up and shower as if you were going to work. And then have an environment that is conducive, nice light, music if you like, whatever. But make a structure to your day. Eat at regular times. And the other thing is something I learned when I was mental health commissioner for New York City, because I started right after one of the most traumatic events in the city, 9/11. And my agency, we received a very large federal grant for post-disaster mental health. And I was in charge of that grant, $137 million over 3 to 4 years. And what we learned was really two things, which I hope people keep in mind. The first thing is that we humans are extremely resilient. And we saw that. We saw people who lost wives, husbands, children, jobs, and they were hurting, but they were resilient, that over time they rebuilt their lives. And it's really important to recognize that we're a resilient species, if you will. The other thing, though, is that if you have a condition, whether it's mental health, maybe depression or anxiety or trauma, or used to be, people are always alcoholic, that's what AA says, you're really vulnerable to a relapse in that kind of post-traumatic state. So it's important to keep an eye out, monitor yourself, or ask somebody you trust to keep an eye out on you, because you're at risk to get sick again, and you don't want to do that. So it's with anything, it's a matter of identifying it early and doing what you can to find ways to keep your head above water.
It comes back to staying connected.
Yes, absolutely. And that's really hard to do now. And the other thing is a really big point that we discovered is the difference between distress and disorder. So anybody living in Manhattan or the nearby boroughs experienced distress, because this is the first time our country had been bombed. And, and if you were in New York, you probably knew someone of the 3,000 people who were killed and others who lost jobs and so forth. So distress was ubiquitous. But stress is different from disorder, because disorder is an illness. It's one thing to have a really hard day, to worry. Maybe you've watched too much replay of the airplanes going into the towers, but that's distress. And distress is not something you treat as a medical condition. In fact, it's a mistake to do that. But there are those people who will develop a disorder. And as I was saying, the most vulnerable are those who had a pre-existing depression, anxiety, trauma, drug or alcohol addiction.
Mm-hmm. From 9/11 to the pandemic, we've seen major stressors that have taken the country in for quite a while.
Absolutely. That's why I wanted to convey that, because COVID surely is a disaster. And so the same post-traumatic phenomena of relapses, of distress, of disorder, what are happening now. And COVID is, in some ways, an even worse disaster because, again, of the social disconnectedness, because of the economic misfortune that so many people are experiencing. And there's no medicine, as you know, and as you assert so well, Ned, there's no medicine as effective as being connected to other people.
Absolutely. Well, the second issue you brought up is the how far behind utilization of the science of mental health lags the actual science. We know so much more in our field than the average customer, consumer, patient, client, whatever you want to call that person, accesses, makes use of, benefits from. And can you speculate on the reasons why that is and what to do about it?
I can, but it may be more useful to consider who's going to change that, who's going to close that gap. and I don't have too many friends as it is, as you know, Ned, so I'm about to say something where I'm going to lose more friends.
You have plenty of friends, Lloyd. He's making fun of himself because he's so honest and outspoken. He's willing to stick his neck out.
Well, so here I go, because I don't, at this point, have a lot of confidence that gap will be closed by clinicians, because they've had decades to do that.
Right.
So I think that if we're going to get better at that, it's because of patients and families being much more assertive, much more advocates for themselves, asking questions, knowing what good treatment looks like in terms of the components of it, as you know, talking, medication, being careful not to drink or drug too much. I mean, these are sort of basic things, and that when someone goes into care, they need to know enough about what treatment should be like, comprehensive in that way, and they shouldn't be shy, or their loved ones shouldn't be shy about saying, hey, wait a minute, why are you just writing me a prescription? Isn't there more I should be doing to get better? So I think my bet is on an informed consumers closing that gap.
Yeah. Over the past few months, I've spoken to my friend, the founder and creator of Omega Bright Wellness, Dr. Carol Locke, about the benefits of taking Omega Bright's omega-3s, CBD, and other supplements. Here's a clip from one of those conversations. Could you tell us a little bit about the recent study that showed Omega Bright reduced inflammation and anxiety in medical students?
This study, this is a great study. It was done at Ohio State, and it was done on medical students, 68 medical students without any medical problems, done over 12 weeks. And it was a blinded study, meaning the researchers and the students did not know if they were taking the Omega Bright or the dummy capsules. And what it found was a 20% reduction in anxiety and a 14% reduction in the inflammatory cytokine IL-6. Wow. So that you had a very powerful benefit from the Omega Bright shown in this study. And that's something that people could use right now in their life, reducing their anxiety and stress and inflammation.
Distraction listeners, you can save 20% on your first order at omegabrightwellness.com with the promo code DISTRACTION. Okay, let's get back to the show. Well, let's take as an example one of your fields of extreme expertise, substance use disorders, addiction, and the average person listening to this show, which is an educated group of people, probably thinks, other than willpower and AA, there's not much to do about it. Suck it up, try to quit, go to AA if you're so inclined, and hope for the best. And in fact, there's a lot more to it that can be done if people would access this. Do you want to talk about what treatments are now available beyond willpower and white knuckling it?
I'm really glad you brought that up, Ned, because people think there's too little that can be done, but longitudinally, we know that people do recover from addiction. And there's no one route, but there is something about combining a set of interventions. And it has entirely to do with regions in our brain where feelings are held, where motivation exists, where memory is formed, where judgment is, so that there's AA or any type, there are different 12-step programs. There's even something called Smart Recovery, which is more cognitive. But AA is a really important way of being connected, peer connection, support, people who know all that well what you're going through because they've been going through it themselves. In addition, there are now 3 FDA-approved medications and a 4th that keeps people alive. The 4th is Naloxone, Narcan, the reversal drug. And I carry it in my backpack, not for me, but because I have friends who have found somebody collapsed in a Starbucks toilet and they overdose, had a needle in their arm. So, and every family, it should be given away at pharmacies, at supermarkets, because drug addiction and particularly opioid, now fentanyl, is all over the place, and overdose deaths just keep going up, including they're gone even higher during COVID. So, and then there's the reversal drug. Then there are 3 medications. The one that I think is most effective and is called Buprenorphine Suboxone. And it was released in 2002. It had been used for a decade in Europe. And when I was commissioner there, that was one of our efforts to try to introduce that into medical practice. And it reduces cravings so that people don't relapse. And there's been some recent work that those people who've been prescribed buprenorphine, which you can get a 30-day supply from doctors who've taken special training, and not enough of them do, but that's, I think, going to get waived. 30-day supply, and you don't have to go to a clinic every day. And if you're on buprenorphine, the likelihood that you will be alive in the 6 to 8 months after you begin it is immeasurably greater than if you don't take it. Because
and it's the treatment for what addictions, Lloyd?
But that's particularly for opioids. The pain pills, OxyContin, Vicodin, heroin, and fentanyl, which is 100 times more powerful than heroin, and it's used to give people with opioid addiction a much harder kick when they shoot up. So that's I think the best one we have. And then there's
I just want to comment. I'm 71 years old, and I'm going to take a course this Sunday to become certified to prescribe buprenorphine. I don't have any patients that I can think of, but I just thought I'd like to be able to do it in case someone wandered in and had an opiate habit instead of my having to refer him somewhere else. Is it pretty straightforward how to do it?
I'm delighted to hear that, and the course is actually very interesting. I've taken it, and you learn a lot, but there's no other medication I know of in this country that requires that you take a course,
right,
and then ask for a special waiver, a special number attached to your licensing, prescribing. But it's a really good thing, and I wouldn't be surprised, Ned, that you will discover that some of the people that you see or are seen by your colleagues in your clinics are dependent on opioids.
Yeah.
And so then you'll have, and I hope others in your colleagues that work with you or for you will also learn it. It is the life-sustaining drug because when people are on it, they don't shoot up, they don't have overdoses, and if they're without it and they have cravings, they satisfy them, they go on the street, they buy stuff, it's too potent, or they shoot up too much in dosage, and they're dead. So buprenorphine. Then there's these old veteran of opioid. Opioids is a general term to convey the drugs that work on this particular receptor, mu receptor in the brain, heroin, fentanyl, OxyContin, so forth. And that's methadone. But most people, it's been around since the 50s, I think, or 60s. But most people don't like it because it's only available at a methadone clinic, and you have to go 6 or 7 days a week for what's called directly observed treatment, where you swallow a little liquid and they watch you, and that's very disruptive, and it's kind of shameful, I think.
Yeah, it's humiliating. I mean, so your average banker doesn't want to go to the methadone clinic, but he'd be able to take his buprenorphine.
That's right. And in fact, in Manhattan, in the financial district, there are probably a surprising number of men and women in finance who are on buprenorphine. And also, I think, some others argue with me, that mental functioning is better with buprenorphine than it is with methadone. And then there's a third medication called Vivitrol, which is an injection once a month. And it works in a totally different way. And some people like it because they have made some moral judgments against methadone and buprenorphine because they actually are forms of opioids. But Vivitrol is a blocker in the central nervous system in the reward center. So you don't get an effect if you take OxyContin or heroin or fentanyl. It just prevents you from getting high. It blocks it. And it's a good idea, but also it's the data on it is that not that many people stay on it for more than 6 months, which is not good enough. You need to be on a medication if it's going to help you for probably 1.5 years or 2 years.
Does it work for alcohol or marijuana?
Yes. Well, actually, Vivitrol got its place in treatment by being a treatment for alcoholism.
Well, that's great. So you have Vivitrol, methadone, Suboxone.
There are support groups. There's these 3 FDA-approved medications. There's the blocker. And then there are the ways by which we take care of ourselves.
Right.
Meditation, yoga, exercise.
Right.
Doing things that we like to do or give you pleasure, whether it's playing the guitar or watching some old movies, anything that is actually good for you. And then especially the contact with people who care about you and whom you care about. You have to stay away from people who are going to be bad for you, who don't have your interests in mind. And that's a really important factor in treatment of addiction.
Stay away from, I could say, stay away from leeches and cultivate lilies. Leeches are people or projects that aren't worth it, and lilies are people or projects that are. And if you can get rid of those leeches. Well, the third area you mentioned was sort of the inequities of the system. And of course, this is a problem as old as time itself, but the black and the brown and the impoverished and the sequestered, I always think the most despised minority group are the impoverished mentally ill, the inequities of that system. Now, you've been working with that your whole career. What are the lessons you've learned?
Well, one is that it is understandable why people of color stay away from doctors, because there's a long history of doctors and hospitals using them as sort of guinea pigs, taking advantage of them.
Right.
So there's trust is one of the main barriers to enabling equity. So it's not only the fact that so many doctors now self-pay, and so many insurers don't pay enough. People have to decide whether they want to have dinner tonight or go to the doctor or feed their family. So a lot of financial barriers, but there is also this view that you can't trust the doctor.
Right. And it's funny, Adrian Walker, probably the best columnist in Boston, had a column in today's Globe about exactly that, and how the getting the vaccine out has been such a problem to Black and brown communities, and the politicians just don't get it. They think, well, Fenway Park and Gillette Stadium, those are good places. Well, for your average person who's not white male or middle class, they ought to go to community centers or churches or small businesses to do it, instead of these big places where people sort of feel intimidated and hard to get to.
Yes, and I think part of creating trust is not only having treatment available, in this case vaccination, at those sites, but it is also the messaging, the value, the power of clergy to help people get what they need. And that, I think, has become more and more part of the repertoire of clergy. And I think that's wonderful.
Yes. Listen, we're running out of time, and as I knew it would be, I could talk to you for a lot longer, but I want to refer people to your website, askdrlloyd.com. That's is spelled Lloyd, Lloyd. Ask Dr. No period Lloyd.com. Askdrlloyd.com. It's a treasure trove of all kinds of things. And you spell Sederer, Sederer. Get his book, Ink Stained for Life, Coming of Age in the 1950s, A Bronx Tale. You'll really love it. It's 14 different stories, each paired with an essay about its theme and contemporary relevance, from when Lloyd was 8 to 17 years growing up in New York. You can find his other books on addiction, on mental health, on public policy, his articles, all of that, askdrlloyd.com. And one of my favorite productions of Lloyd are his reviews. He really has a true critic's eye, and could easily write for the Times or wherever reviews of plays, movies, books, and treat yourself to one of his wonderful reviews. I'm on his mailing list, so I get his reviews regularly, and you can sign up for that at his website, askdrlloyd.com. Before we say goodbye, do you have any final thoughts or concerns or anything you'd like to say to this audience of intelligent people?
What we learned after 9/11, Hurricane Sandy, other disasters, is that people are resilient, and faith makes a difference. Faith, and not necessarily an organized religion, that's okay too, but a sense that you're part of a larger whole, a universe, you're connected, that
yes.
Life is continuous, not only when you're alive. That sense of faith, that spirituality, these are vital. This is a vital element in staying the course and bouncing back and being resilient. Don't fight it. Find it, cultivate it, and be with other people you like and who like you. That's
such wonderful, wonderful advice, and I Can't thank you enough for joining me. I'm sure my audience is smiling right now, as I am, at the just the colloquial but also extremely well-trained wisdom that you've offered us today. Thank you so very much, my friend, Dr. Lloyd Sederer. Okay, well, that's it for me today, and many thanks to Dr. Lloyd Sederer. He's truly a treasure of a man, and just a font of talent, wisdom, and humanity. And if you haven't already heard, the new book that I co-wrote with John Rady is out. Please get a copy of it and bring it home and make it your very own. The title is ADHD 2.0. Click the link in the show notes or by going to my website, drhallowell.com. You can also find it wherever, as they say, books are sold. And please remember to reach out to us with your questions, comments, concerns, ideas, thoughts, whatever you might want to send us our way by emailing us at connect@distractionpodcast.com. That's the word connect @distractionpodcast.com. And give us a like and a follow on social media. Distraction is created by Sounds Great Media. Our recording engineer and editor is the extraordinarily talented and always interesting Scott Person. And our producer is the equally talented and almost always interesting, I'm just kidding, she's always interesting, Sarah Gerton. That's it for me, Ned Hallowell. Goodbye. The episode you just heard was made possible by my good friends at Omega Bright Wellness. I take their supplements every day, and that's why I invited them to sponsor my podcast. Shop online at Omega Bright, and that's BRITE wellness.com.